So my name's Kennedy Patterson, and my partners are Jacob Loomis and Tanner Milliken, and we're going to talk about Bell's palsy. So Bell's palsy is the drooping of typically just one side of your face. It's a neurological disorder, but it also affects the muscles in your face. So though the exact cause is unknown, doctors do assume that it's due to inflamed, swollen, or compressed nerves, specifically the seventh cranial nerve that's in your face. And as you can see in the picture, it's kind of highlighted there. There's two of these nerves in the region of your face, and so yeah, that's what's affected during Bell's palsy. The most common cause of this is a viral infection such as chickenpox, flu, or shingles. Because what this does a lot of times is it'll cause the face to be inflamed, and then the nerve is compressed, and then that brings the symptoms of Bell's palsy. And also stress can be a cause of Bell's palsy, because stress weakens the immune system and it also compresses that nerve. So with that, the nerve is damaged, and then typically only on one side of the face again, you'll see those symptoms coming. So some of the symptoms that your relative may experience is weakness or paralysis on one side of the face, facial drooping, drooling due to the lack of control over muscles, pain, which would be caused by just the inflation and compression of the nerve, depending on which one it is. Increased sensitivity to sound, and this is because the cranial nerve also brings impulses into the small canal in the ear. Loss of taste, because it brings impulses to the tongue, and the changes in amount of tears or saliva that your relative may produce, because it also brings impulses to those areas and to the ducts in the face. And lastly, a headache, and as I stated previously, in rare occasions it will be experienced in both sides of the face, but usually it's only in one. So as you can see in the picture, the facial nerve is damaged on one side, and then on the opposite side of the face is where you'll see the symptoms taking place. So some people are at higher risk, so if your relative has any of these, just keep that in mind. The first one is pregnancy, especially during the third trimester or a week after birth. And this is due to the fact that the total water difference in your body changes over that time, and that can cause swelling or compression of the nerve. Also, as I stated before, viral infections make someone more susceptible to this disorder. So the upper respiratory infection, again, it'll just cause swelling in that area. And lastly, diabetes. People that are diabetic have poor glycemic control, so that will also cause the same symptoms. And family history also, if there's anyone in your family that has experienced Bell's palsy before, it's possible that reoccurrences may take place, but that's pretty rare. So I think it's only like 4 to 14% of people have that. So. Next, the diagnosis. A lot of times they'll simply just look at the face and do a facial exam. So they'll have patients or your relative do simple tasks like showing their teeth, raising their eyebrows, things like that, in order to kind of see the facial function and movement, along with asking about the signs and symptoms that are taking place. If the symptoms are unclear, they can also do other tests. One of them is an electromyography. And this will just show the nerve damage that's taken place in the face and the function as well. It'll show how fast the impulses go across the face. And so obviously, if they're not moving as fast as they normally do, that'll show signs of damage. They can also do image scans such as MRI and CT scans. As you can see in the picture, the top picture is someone with Bell's palsy, so there's a small abnormality in their brain, and then the bottom one is a brain tumor. So a lot of times these two things can cause like the same symptoms in the face, the drooping and things like that. So it's good to rule out other causes for the symptoms that are taking place. So next for treatments, most people from Bell's palsy will be fully recovered, but each case is different, so just keep in mind that the doctors will be doing everything they can to figure out what's best for your relative and their treatment processes. So they can offer medications such as corticosteroids or antiviral medications if they do have a viral infection in the body. They can also do physical therapy in order to regain the muscle movement in the face. Surgery is rare, but it is possible if needed. They can also offer lubricating eye drops to make sure that the eyes don't dry out at night and that they're not affected, and wearing eye patches will also help with this. Acupuncture can help bring impulses and sensory back into the face. And lastly, biofeedback training is used sometimes, and this allows people to learn how to use their own thoughts to control their body. So biofeedback training can help gain better control over facial muscles. For prognosis and follow-up, so Bell's palsy does not routinely require referral to ENT surgery, though in some cases, if there's complete facial palsy, referral is recommended to patients. This disorder is rarely fatal, but an appointment should be made if symptoms are reoccurring or not going away after 2 to 3 weeks. This disorder should settle over those 2 or 3 weeks usually, and only about 4 to 14% of people have reoccurrences, as I stated previously. And if this is the case, your relative will know beforehand, because usually that's only with family history. And again, this disorder is rarely fatal, so nothing should be worried about as long as symptoms are regressing and going away after 2 to 3 weeks. And these are our sources that we use, so if you have any questions, feel free to ask. Otherwise, you can find more information on Mayo Clinic.